Welcome to Aging Well Podcast. It's a podcast series that focuses on raw, unfiltered conversation on aging. So let's get into it.
Second episode with Lo.
Carers who are in the field doing the work, they're feeling heard, they're feeling seen, they're feeling supported, and they will then give more of themselves to people. They will give patience, they'll give time. And, if they're if they're visiting clients who, where the cultures don't necessarily match initially, they're going to take the time to be patient and enjoy that and maybe learn a little bit about that culture because they'll have that. They'll want to do that and respect their own. But then the ripple effect is that potentially you've got a lot of happier clients, healthier clients that are living longer, so that when you do have those few that really genuinely have health incidents, there are people available to manage that, So it's, for me, I look at that and perhaps that's a very simplistic view on things, but I just think that little piece of love, if that is in there and you pop the key in the lock and you turn that love and open it up for everyone, there's just this beautiful big impact that can really help a business shine.
Absolutely. And look, you guys are the true reflection of that, right? So
thank you.
you guys have created that because you guys believe in it.
We absolutely have.
Right? You guys believe in it. I have spoken to one of your workers. She looks after one of our clients. They are a match made in heaven. Actually, I think about 2 or 3 clients are currently utilizing your services, right? And you can see the bond they have, right? And it comes from the top. You start at the top. You
totally does.
You radiate that vibe across the organization, right? Once you start radiating that, everyone who comes into the team, they join because they want to go I want to be like you. I want to be with you because my vision aligns with yours. My values aligns with yours. If our values are not aligned, we shouldn't be together. That's
100%.
Pure and simple, right?
Yeah.
And that's how it should be. That should be the way. Should be the way. If you create
and it's so easy to be like that, isn't it, Archie? It's so easy to be like that.
It's not difficult. It is definitely not super easy.
Reworking my words. Okay, yeah.
No. Look, it is easy. It is not difficult because at the end of the day, you're the boss in your organization, right? So you know who you want to hire. You know what type of team you envision it to be. It is completely within your control. That's the element you do control. So if someone who is there is not aligned with your value, you don't want them in your team. It's not being...
And it's obvious, they stand out as well.
Yeah, they will stand out. And then if you don't fix it, then it will carry on, right? If you reward poor ethics, poor behavior, what do you think is going to happen? It's going to trickle through the entirety of the organization, right?
Yeah.
That's why you talked about that imbalance, that it's you are an associate provider, I am a provider. So I'm the mom, I'm the dad, you come to my home, you follow my rules, which happened in our homes, for example. It's just we grew up for an example, but it doesn't work. It doesn't really work that way. Things actually works really well when you work in collaboration. Right? Collaboration always works better, produces better result. One stick is easy to break, but if 10 of you are together, it's really difficult to break.
Yeah.
It's extremely difficult to snap. If you're just one, easy snap. But if everybody is together, extremely hard, extremely difficult to snap. Yeah.
I love that. So
yeah, you go first.
Yeah, I'm interviewing you now. We wanted to talk a bit about workforce shortages, and I thought that was a nice segue into it because I know that when we kind of discussed this a little bit outside of this podcast in preparation, and we both had really different views on it. And I'm wondering, especially when it comes to those cultural connections that you and I really want to advocate to build in the sector, how do you find, as a registered provider, dealing with the workforce shortages? And where is it specifically? Like, what are the workers that you're having issues finding?
Well, that's a great question. Thank you so much for asking a brilliant question. I actually did not prepare for this. I do know the pain though. I do know the pain because there are areas in Victoria, for an example, we know for a fact there are workforce shortage. Anywhere past Geelong, all the way up to the Adelaide border you go, there are workforce shortage. Now, Tom Simonson, I think he did an interview with Anthony in one of his podcasts, and one of the key things that he said that we need to train our own people, otherwise workforce shortage is going to remain, it's not going to go anywhere. Additionally, about a year and a half ago, I made a comment on LinkedIn on a gentleman named Tim Hicks. He's a general manager, I believe, Bolton Clark. He does quite a good analysis on stuff, and one of the key things that I mentioned in his made a comment that we need to talk about workforce shortage at a grassroots level. The entire globe is growing older, and Australia is getting older as well. I'm getting older, which means in about 20 years' time, how long can we just rely on, we're just going to import talents, right? Yeah, it's good, it's great, it's working now, it's fine. It will also happen 10, 20 years from now. As populations will increase, it will happen. It's natural. But again, we also can, in the long run, we also have to talk about it in a grassroots level, at a school level. What are the importance of having a nursing assistant, personal care workers? It's a pathway. Nursing itself is a great profession. What's the beauty of it? What are the things that you can do as a nurse? Really highlight those things at a grassroots level. And I'm talking about a long-term solution. I'm not talking about a short-term solution. Short-term solution, you tell me. We have a pain. Majority of the industry, majority of the providers have a massive pain. Specifically those who are in the regional setting, they are doing everything they can to retain talent through migration, through skilled visas. They're doing everything.
Bonuses through high.
And you know what happens oftentimes? Once people get their permanent residency, they move up to the big cities, for example. Some stays and build a beautiful life. Some moves up to the big cities because the population is heavier in the big cities. And then, naturally so, you solve the problem for a few months, few years, and then you're back on. That's the trend that we have seen. And now, think about it, we are servicing past Geelong, and it is a tough area to service. I wish I could have someone to earn money, unfortunately. There are people who can go and play, but they don't work hard, so you can't really put them there. I'm a big advocate of that. So from my perspective, it doesn't bother me about for sure as much because maybe we think a little bit differently, but we don't need, like, of course it's all about margin, right? How much margin I can get out. Let's be honest about it. There's no two ways about it.
No, that's the reality of the business,
the
right?
reality of it is, I still think also the margins we have somebody, let's say, come to Victoria as a non-employee, there will be a better margin. It is true, there will be a better margin, but then you only have 3 clients. That person is not going to be happy with 3 clients, right? So,
And that's what we talked about before, right? Like the reality of the operations
it's very clear. We will always use an associate provider to give us the work, because that's our bread and butter. It's how we have scaled all our organizations. So yeah, I'm a big believer of that. I do believe in collaboration. I was in your shoes, so I know exactly how it feels. So I also know I work with previously. They also model their business exactly the same way. They became successful, so it's proven, it's tested, it works. If you're playing a short game, maybe not. If you're playing a very long game, it works. Whatever you create, you have to create something that is sustainable. It is person-centered, because at the end of the day, you are looking for someone's parents or grandparents in their home, and even if it's also money, at the end of the day, someone who will get their parents or grandparents in their care, ensuring that they have every single bells and whistles that you told. So
That's okay. That's what we do in the podcast, right? We have passionate about things, right?
I'm a big believer of having a really good associate provider next to me, because you can achieve amazing results. You just
Oh, I mean, that's lovely. It's awesome to hear you say that, shout it from the rooftops.
look, like I said, I was in issues so long ago. We actually own a recruitment agency, right? So our other business, our associate provider to me, we basically you can be biting your own hand. Like,
Yeah, exactly. Yeah, no. No, I agree. Yeah, no, I totally agree. It's interesting because, like when we don't really experience workforce shortages. However, we are predominantly Metro Melbourne, and we are not nurses. So we have personal carers and we have domestic assistants, and the domestic carers, we put through training. They will obviously get all of their screening done and make sure they have their police report completely cleared. All the screening is done and put them through their training. So we find that pool of people to bring on board actually quite easy. There's a lot of parents and grandparents that want to come back into the workforce, and so for us, it's really easy for us to give them that opportunity to be able to do that. And what I find more and more is that so many people really display these care values. And I read recently that Volunteer Australia, they have 5 million people volunteering, right? Regularly, 5 million. Okay, so of that 5 million people, there's definitely a percentage of them that are volunteering for human beings. Okay, so those people themselves are doing it for no pay whatsoever. So I think when there's organisations that can create these jobs for carers, because there's millions of them out there where they can be paid, that's an incredible thing. That's a wonderful thing. And perhaps, there's a little bit of competition. Oh, wait a minute. Sorry, Hugo.
No, keep on.
We're going to say, oh, sorry. And, perhaps there's something in that where there is a lot more internal growth that happens. For us, we don't employ nurses, so I probably don't have enough insight on that. But I will share a personal story. And I think that this will either resonate with people or it will be really confronting and people will go, "Ugh, I don't like that story." But that's what you and I do, right? So
Let's be controversial.
feel free to cut this if it's inappropriate. cousin's dad, who said it was just completely toxic and she couldn't wait to get out of here. How awful is that? So if this is the experience of a young person who is studying to be a nurse, who's an Australian citizen, and this is the experience that they're getting, imagine the experience that everyone else is getting as well.
Don't go to childcare.
Preach.
Period. We have seen horrible news coming out from New South Wales in Sydney, Western Sydney, right? We have seen horrible news coming out of Melbourne, right? Now, the news that are coming out, these are the extreme individuals. These are the extreme cases, right? But there are also cases that happens every day, and it's almost like everyone is desensitized about it, right? Now, I understand that working inside a nursing home may not be as glamorous the way we portray, and there are a lot of great people who are working there, but there are also a group of individuals who are there who are not I don't know how to say this, but
not there for the right reasons, maybe.
It's just, if you're having a bad day, don't go to work that day. That's how I'm just gonna say it that way. If you're having a bad day,
that should just be a natural thing that happens, right?
I have seen an elderly gentleman and basically husband and wife. They were in one of the biggest, very well-known aged care facilities. And I was basically coming out of the main office, and then basically this carer was with the husband, and the wife, she's living with dementia, not very high, but she's living with dementia, and then the husband was basically chasing her, right? I always tell this story. The husband was kind of like, "Hey hon, come back," and this lady came out and goes like swearing at him and saying awful stuff. So I had to stop that person, right? And I was like, dude, like, I'm an outsider and I'm watching this.
Yeah.
It's not very nice the way you're treating this person. Like, oh, you don't work here, you don't know. I was like, yeah, I get it, man. I don't work here, I don't know. I get it.
Yeah.
I get that.
But that's not an excuse. That's not an excuse.
I mean, I get that fact that, okay, he's chasing after her, which can result to a fall, which can result to lots of different IRs and SIRs, whatever, right? All of the red flags, I get it. I understand it. But would I behave like that? No. You can.
And we don't teach our kids to behave like that, do we? And our parents didn't teach us to behave like that.
Yeah, and it's like I said, I don't know how to. If someone goes like, oh no, it doesn't happen in residential, I'm sorry, you're blatantly lying. A lot of things happens. It just doesn't come out. It just doesn't come out, right? It's same thing in childcare. Probably a lot of things happens. We don't know, right? So not everybody is like that, but there are people like that, and I think people should call it out, rightfully so. Like I said, they should be reprimanded. Like, hey, if you do this again or you've been found about this, you're gonna be done. I know we're cutting close to our time, but this is a really, really important thing you mentioned. The experience that your young cousin faced, and oftentimes that is off-putting for a lot of individuals who are young, who we need in this industry to address the workforce shortage. they don't come because they look at it and go like, I don't want to work like this. I don't want to go and to an environment like that. I don't want to do this. It's not, first of all, it's not cool to hang out with my granddad. Then I'm going to go to a situation where I see abusive behavior. Yeah.
Yeah.
It's
Well,
not
this
very.
also lends to, when you're bringing migrants into those opportunities as well, right?
Your camera got stuck.
You've got to be able
Low.
to give them a
Wait,
good
so
experience. Oh,
your camera is working now. Perfect.
sorry.
Yeah, go on. Yeah.
I was just saying that when you have migrants who are also coming into those jobs and roles,
Yeah.
Part of the incentive to keep them there would be having a good work environment. And absolutely agree that there are separate issues for regional and remote areas in terms of accessibility of facilities, and maybe even at times there's a cultural disconnect still, where they don't have where there may be a language barrier, or even just, little food, their, cultural traditions stuff don't exist in those areas, which would then draw them into metro areas. But I think it's so important that, everybody just plain deserves the right to be treated with respect. That's just a no-brainer. And I think B, that if, part of the issue of attracting people into aged care is the fact that there is a lot of disrespect that operates in it, and disrespect in workload, in, time given to people, being able to be given to people, maybe the training as well, even the environments, all sorts of things. And I think that's the layer that really needs to be peeled back and looked at.
100%. I think look, everything starts at home. A home care or a residential, whatever you call it. At the end of the day, a country, right? Like everything starts with a grassroots level education, whether they are migrants, new to the country, or 5 years, 10 years, doesn't matter how many years, it doesn't define anything really. It defines its humanity, it's built within, right? You don't go to universities and get I'm going to be really nice and caring from tomorrow morning because I got a bachelor in nursing, right? It doesn't work like that. You either have it or you don't.
That's right, yeah.
If you don't, don't go to this industry. This is not for you. Period. I think everyone should just come to an understanding. Look, if I'm not loving, caring, maybe I should do something else with my life.
Yeah.
It's that simple, right? You cannot teach someone to be nice and caring with a Cert 3, Cert 4, or a bachelor's, or even a master's degree. I'm sorry, that's just not going to happen. You either have it or you don't.
Yeah.
If you don't, there are plenty of other things.
That's what we're talking about, right? Yeah.
Well, I'm
I can't do that. Hang on.
I'm leveled up now. I'm full.
You're cooler than me. You're so much cooler than me.
Oh, I'm full. I don't know how to say it. It's just so cool.
You're
I'm so
so
cool,
lit, Archie. You're so lit.
Getting. Yes, you need that heart. You need that heart to work in this industry. And look, I am completely on par with you. We need education, training. Basically, those who are creating organizations, or we have created organizations, and through our words, we should really look inside our home. We don't need to go and fix everybody outside. We should really look inside our home, whether our house is in order. It requires that education from the house leaders, from the parents, to basically go, hey, this is not an acceptable behavior. What is acceptable? What is not acceptable? Teach them about kindness, because kindness goes a long way.
Yeah.
Look, if you talk about finance and kindness, they're both very related. If you make a really good name, money comes into the door. It doesn't go away. It actually comes.
Yeah.
It actually comes. If you do well, if you do good enough jobs and people are talking about you because you're doing a brilliant work and you're bending backwards to make sure things are working okay, and you're treating everyone with love, respect, and dignity, money will come.
Absolutely, it will.
You don't have to go and make everything about money. Money comes. Behavior, I totally agree with you. More training, more learning. Industry leaders, less complaining. We should really look into okay, how do we make this more of a place to thrive? Right? We can do more. We can certainly do more. This is not an industry like I said, it's like childcare, right? We can't neglect childcare. We can't neglect aged care, because these are our child and we are going there. these are very personal, extremely personal, right? We can't put our kids into a crappy childcare because they're our kids. We can't create an industry which is like, it's a beautiful industry, but we have to say those really difficult, we have to look into each other's eyes and go, let's be honest with each other. We have some questionable things here, right? We got to be honest.
Yeah.
Right? And that's where change happens, when you know yourself that, oh, I got some shortcomings, I need to do better.
Yeah, that growth piece. And aren't we all just growing? We're growing
Absolutely.
all the time,
Growth mindset. Growth mindset. I've always said it, growth mindset is so important for our industry, because at the end of the day, me and you, we're talking about us in 20 years time.
100%. Yeah.
Right. All righty, Lo. It was a brilliant episode. Not as this is a very serious episode, in fact. Right.
It got serious.
Like very important topics. Very, I believe, some topics are very touchy, very controversial, but I believe this is a platform which we can use to actually tap into the truth factor, tap into the being uncomfortable is a place of growth, and we can have these kind of conversations here and really, really get everyone together. Maybe, let's talk about what's uncomfortable and how we can fix those things that are kind of not broken, but we can do better.
No, I agree. I love it. Thank you for having me.
Thank you so much for coming in. It was lovely as usual. Maybe we'll do a third one.
Maybe.
We'll definitely do. We'll do a third one. All right.
Oh, great. Three's a charm, right?
All right. Yes. Thank you, Lo. Take care. You have a splendid day.
Yeah.
See ya. Bye-bye.